Hi everyone, welcome back to Raw Online. Today we'll see about peptic ulcer disease. The stomach, it has the cardia, the fundus, the corpus or the body, the antrum and the pyloric sphincter. Normal histology of the stomach, various glands are there in particular regions of the stomach and they have particular cells which have characteristic their own secretions. So, the cardiac glands, they are the mucus secreting cells which secrete mucin. The gastric or the otherwise known as oxyntic or fundic glands, they are present in the fundus as well as the body which is otherwise known as corpus, and they have the parietal cells secreting acid, chief cells secreting pepsin and other digestive enzymes, and endocrine cells. Antral or the pyloric glands, they are again mucus secreting cells, they also have some endocrine cells. Cardia and the antrum, the proximal as well as the distal stomach, they have the foveolar cells which secrete mucin. Antrum, it has the G cells secreting gastrin. Fundus and the body have parietal cells secreting acid. Fundus and the body, they also have chief cells secreting digestive enzymes like pepsin. So, mucus cells secrete mucin as well as pepsinogen 2. Parietal cells present in the body secrete acid and intrinsic factor. Chief cells secrete pepsin, and there are various endocrine cells which secrete particular hormones. G cells secrete gastrin present in the antral mucosa. Enterochromaffin cells producing histamine which are seen in the body. D cells secreting somatostatin and X cells secreting endothelin. Acid secretion is very important in maintaining the gastric milieu. The normal pH of the gastric lumen is 1. So, it is so much acidic. There are various phases of acid secretion. There are 3 phases. We have all read that in physiology. Cephalic phase, it is initiated by the sight, smell or taste, and chewing. It is mediated by the vagal activity. Gastric phase, as we take in the food, the stomach distends and it stimulates the gastrin release from the antral G cells. That is gastric phase of acid secretion. Intestinal phase, it occurs when the food enters the proximal small intestine. So, these are the phases of acid secretion. There are various receptors present which are responsible for secretion of the acid, which is mediated by the proton pump activation. Acetylcholine, it activates the muscarine type 3 cholinergic receptors which leads to increased calcium in the cytosol. Gastrin, as I told, present in the antral mucosa, attaches itself and stimulates the gastrin receptors and also causes increased cytosolic calcium. Gastrin as well as vagal afferents, they stimulate histamine from the enterochromaffin cells by stimulation of the H2 receptors, and ultimately everything leads to proton pump activation. There are certain factors which protects the gastric mucosa from the ill effects of this acid. First and foremost is the mucus secretion. Next comes the bicarbonate secretion from the surface epithelial cells. Then the gastric mucosal epithelial barrier itself, which protects the gastric mucosa from the ill effects of acid. And the gastric part of the mucosa, it has rich mucosal blood flow that is essential for the oxygen supply and good nutrient supply. Prostaglandins, yes, they are very important role in mucosal protection. They decrease the acid secretion, increase the bicarbonate and mucin secretion, and also improves the blood supply. So, these are the factors which are responsible for gastric mucosal protection from the acid. So this is a pictorial representation of various protective factors of the gastric mucosa and injurious effects of the gastric mucosa. So normally damaging factors are usually gastric acidity and the peptic enzymes. So this is the gastric mucosa, the gall glands and the pits, the lamina propria. Then we have the muscularis mucosa, submucosa, then muscularis propria and the serosa. These are the 4 layers of the stomach. The protective factors, as I told, are surface mucus secretion, bicarbonate secretion, mucosal blood flow, epithelial barrier function and epithelial regeneration and prostaglandins. If any of these factors are affected because of various etiologies, then it leads to increased damage to the gastric epithelium, leading on to gastric ulcer. So, H. pylori infection is one of the important cause of gastric injury. Next comes the over-the-counter pills which are used in self-medication of the any pain or joint pain or fatigue or anything. Then alcohol and tobacco smoking, gastric hyperacidity and duodenal or gastric reflux which we saw in the previous lecture. So all these factors, they cause increasing damage or impaired defense mechanism, and there are also certain factors like ischemia, shock and again NSAIDs. So they all lead to damage and irreparable. The regenerative capacity of the gastric epithelium is lost and so it produces erosion which progresses to ulcer formation. So it consists of necrotic debris, then acute inflammation, granulation tissue and fibrosis which is having a mnemonic as NICS.